just as long as you get everything or look at every area that you're supposed to be looking at. So the first thing I normally do is I go ahead and just kind of palpate the lips. So I'm going to have you to open just a little bit more, and I'm going to bi-digitally, it's hard to say, palpate. So I'm just kind of feeling, see if I feel anything unusual. And I don't. Okay. And then I'm going to palpate the top. Y'all notice how when I do the top, I stand behind her and I'm kind of using my index finger and my thumb, and I start at the outer, the corner of the mouth, and come to the anterior. And then when I do the mandible, I come in front of her and just kind of turn your palms out, and then kind of work to the anterior. So that feels good. Don't feel anything weird there. Okay, now I'm going to get you to open for me. And I'm going to go ahead and kind of look around at the buccal mucosa. And I do see some linea alba. Remember the white line? So I'm looking at that on the buccal mucosa. I'm also looking for the opening of the parotid gland there. Remember, that's called the Stenson's duct. And you'll see like a little flap or a papilla right there. Oh, okay. Can you see where you are? Not everybody will be able to see it, but right in there. Okay. I'm going to go ahead and look on this other side too. So I'm going to let you turn away from me slightly. And let's take a look. And I see linea alba on this side. Do you tend to bite your cheeks a lot? Do you kind of chew on your cheeks? All right. Now, so you notice when we look there, we don't see that frenum very well because that graft is covering that frenum area. Okay, so if I pull up here, we'll probably find the frenum. Yeah, there's the little maxillary frenum. Okay, I'm also looking at the gingiva, like I was looking there, looking at the gingiva, the color of the gingiva. Okay, put your head back. Okay. Now I'm going to get you to open, and I'm looking at the hard palate and soft palate, the rugae behind the front teeth. I'm going to feel on the palate. I'm going to slide my finger from side to side, looking at the hard palate, and I can feel a little tori there. I feel a palatal tori. Okay, all that looks good. Okay, where the other ones are. Okay, so go ahead and let me look at this side of the tongue. So looking at the lateral border of the tongue. Okay, all right. Now I'm going to get you to stick your tongue out for me. This is the part I hate. Okay, I'm going to get you to say ah. Kind of relax your tongue a little bit. It's hard. I know. I shouldn't have said anything, should I? Okay, go ahead and stick your tongue out again for me. I won't put the mirror back there. And just say ah for me. Do you have your tonsils? Do you remember how? Okay. Try one more time. I'll try not to stick that mirror back there too far. Say ah. He says, you're not getting that.